My name is Catrina Robinson. I am currently an assistant professor at the Medical University of South Carolina in the Department of Neurology. My interest in science began years ago as a child witnessing my grandmother who was diabetic, but also experienced dementia as she got older, and as well as many strokes. So that was really my first thrust into really wanting to understand medicine and science. In addition, my mother was diagnosed with breast cancer when I was approximately 9 years old. So witnessing her journey through her health and trying to recover from and the many surgeries that she underwent with her breast cancer really sparked my interest in science. And I always asked why, and I wanted to know more. So that's where my journey began. I initially wanted to go to medical school. However, after graduating, in undergrad, I was taking biochemistry 2, began to struggle and needed a tutor. So I began to meet with my tutor, and she noticed all the questions that I was asking. My tutor was currently a PhD candidate at Auburn University in pharmacology. So I began to volunteer in the laboratory, and her project was focused on understanding the connection between diabetes and Alzheimer's, which it made it really personal for me knowing what my grandmother was going through. So this began my journey through science and gaining my PhD from that same laboratory at Auburn University. And currently my research has taken me a full circle. When joining Eva's laboratory, my focus was on getting more experience with aging models and trying to understand the impact, the molecular mechanisms underlying aging. And currently I am back into understanding the link between diabetes and all the other metabolic disorders and its impact on stroke recovery, as well as cognitive disorders such as Alzheimer's disease. Throughout my career, I can honestly say that she has been the one most impactful mentor in my life. She has always been brutally honest, and she taught me how to accept constructive criticism very well. I had to learn that along the way. Eva I would consider her a motherly figure. She's very stern when she needs to be stern with you, but she's also has a very big heart. And there were many circumstances that I went through while being in her laboratory where I had to depend on her, not only as a mentor, but also as a friend. My mother passed away during the time where I was in her laboratory, and she was very, very compassionate. And she made things a lot easier for me during that time. And I think my success now as an assistant professor is a testament to her great mentorship, being a woman, but also an African-American woman. I've depended upon her for a lot of advice of how to navigate science being a minority. Recently, I had the opportunity to work with Dr. Feldman on a review that was found in the Neurology of Disease, a special edition. We talked about our work surrounding obesity and cognitive impairment. The literature demonstrates clearly that early to midlife obesity is associated with cognitive impairment, as well as other disorders such as stroke and Alzheimer's disease. Our work really is focused on understanding the impact of diet and the effect that it has on the brain and the early changes that are observed. What most people don't realize is that what you eat really does affect your brain and the possibility to develop disorders later on down the line. So one thing that we're focused on is, can we make changes to our diet, even after we've had years of unhealthy eating, to really impact our brains in a positive way? And the answer to that is yes, you can. It's never too late to eat better, to be healthier, and to get more exercise. Now, I realize that that's not feasible for every single person, and there are other avenues that you are able to consult with your physicians about. But the literature clearly shows that reducing weight and eating healthier is overall has a great impact on your brain's health. If you were to take a look at the incident maps for stroke, for diabetes and obesity, as well as for Alzheimer's disease, one thing you'll notice is that the Southeast has a high population for all three of these disorders. What this means to us is that there's something specific about the Southeast. And one thing we think about, I'm from the South, I'm a Southern girl, Southern food could be a major driver for some of the disorders that we see, such as having an impact on your diet and cognition, as we discussed earlier. So one of the studies that I am heavily involved in is really trying to understand how in the African American community, poor stroke recovery is such a nuance. So African Americans tend to recover more poorly from stroke. And so I have a partnership with some clinicians, and where we're trying to implement various interventions to try to improve stroke recovery and really try to understand if there are potential biomarkers that we can detect from these patients to determine who's more at risk for poor recovery outcomes.